Okay. Hello, I am Deb Stittman, and I serve as chair of the Addiction Counselor Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I'm going to ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Jacqueline Lightcap.
Here.
Christina Boyd.
Here.
Lisa Carter.
Here.
Jason Hess.
Here.
Shane Hudson. Chad Jacobs.
Here.
Michael James. Mr. James.
And Deb, I do see Mike James on the Zoom call, but looks like his camera.
Looks like he probably stepped away. Okay, Charity Cosin. Did I say that right? Charity?
Cosin.
Cosin.
Yeah, here.
Dulcinea Rakestraw, PhD. Here. And Sana Shook. Don't see her. All right. I also note that the BSRB staff members are present. David Fye.
Here.
Leslie Allen.
Here.
Ashley Van Buskirk.
I think she'll be joining us as needed if she needs to step in to provide some assistance.
Okay. And then so David will now read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals, but individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting the meeting publicly, remotely, by conference call and other teleconference ability, I state for the record the following information. Public access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended, so we will be conducting this meeting pursuant to KOMA. On November 2nd, 2021, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials will be posted to the board's website on the day of the meeting, and those are currently posted. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240, or currently the best way to reach staff directly is by bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Deb, I did see that Shane Hudson is in the waiting room, so I'll go ahead and let him into the meeting. And I wanted to check now, we do have the conference call line active, so if there's anyone on the conference call, go ahead and identify yourself. Okay, I don't hear anyone, but if I hear a beep that someone enters, I will let you know.
Sounds good. Thank you, David. So this meeting's now called to order, and we'll begin discussion of our first item, which is introduction of our new advisory committee members. Welcome, Charity and Chad. So Chad, do you want to say a couple words, just kind of your background and what brings you to this committee?
Hi, I'm Chad Jacobs. I work for Center for Change here in Wichita. Been here almost 6 years. Been in the field a little over 15. And I saw that you guys were looking for new members, so I applied and here I am.
All right, well, welcome. We look forward to your contributions. Charity?
Hi, I'm Charity. I am the Executive Director of KISA Life Recovery currently. I have been in the field for about 10 years. And I just thought that it would be interesting to join the board, and Steve Brazil thought that I would be a good fit for it and thought that it would be a good experience. So here I am.
Great, welcome. Thank you for your interest. I thought it might be helpful for all the committee members to also do the same so that you can start to put faces with names, and because we do have kind of a diverse group of folks around the state and different things that we do. So I'm just going to go with who I see. First, Jason.
Hi, I'm Jason Hess. I'm the Executive Director over at Heartland Regional Alcohol Drug Assessment Center. I'm outside of you, Deb, who's on the BSRB board. I think I'm probably the longest tenured person in this committee right now. So
You are.
Deb's getting ready to try to get rid of me. So
Never. I think we'll be scooting at the same time because my time at the BSRB is gonna end here in 23. So, okay, Dulce.
Hello. Welcome to Chad and Charity. It's nice to see your familiar faces. I have worked in the field now for, I don't know, a long time, over 15 years. And like to follow Deb with all of the amazing things that she does. I'm currently at Wichita State doing research, but I'm still involved in the field and doing trainings, and here in Wichita helping with the Substance Abuse and Mental Health Coalition, where we're trying to address some crisis services that are a desperate need in our community.
Thank you. Lisa Carter.
Good morning and welcome. My name is Lisa Carter. I am the co-director for the Mid-America Addiction Technology Transfer Center. I've been in the field, over 25 years now. So welcome and appreciate your interest in serving on the committee.
Christina.
Hi, it's really great to meet you, Charity and Chad. Glad that you could join us. My name is Christina Boyd. I currently work as an associate professor of practice for the KU School of Social Welfare. And although I work for KU, I'm not in Lawrence. I'm actually live and work remotely out near Dodge City, Kansas. So I am way out in Western Kansas, actually near Jetmore. Not many people know where that is, so I always say Dodge City just to give you a reference of where I'm at. I also, along with Lisa, I was just trying to add it up. It's been about 25 years in the behavioral health field now. So just like Lisa, we both started when we were 12, just to answer that question. But yeah, so anyway, glad to be here and good to meet you guys.
Thank you. You're looking very stylish today with your red glasses and your red jacket. Jacqueline.
Hello, my name is Jackie Lightcap and I live in Topeka. I'm a public member of the BSRB. So that is, I serve in that capacity on this board. I am co-president of the League of Women Voters of Kansas, and I am also on my local school board. And I'm raising two teenagers, one of whom is a senior graduating. Today is finals last day, so anxiously checking the grading portal. But anyway, glad to be here. Welcome to our new faces.
Thank you. Mike James.
Excuse me. Greetings to both of you. My name is Mike James, and I currently work for Kansas City, Kansas Community College, and I'm the coordinator for the addiction counseling associates and certificate that we offer. I have been in the field of 22 years. So I guess Lisa, Christina, you guys may beat just by a little bit. Somehow we ended up on that other end of the spectrum. But welcome to the committee. I've been here for almost 3 years now. It's been very interesting. I think you guys find it a good committee to be on. So,
Thanks. Shane Hudson, are you on?
Yeah, this is Shane Hudson. I'm the CEO of CKF Addiction Treatment. We're based out of Salina, Kansas, and provide some services and some integrated services in primary care, acute care settings across the state. I've been at CKF for 11 years in various roles. I previously worked in child welfare and also a community mental health center. So yeah, that's me in a nutshell. I can't remember how long I've been on this committee. That's a good question. A few years, 4 years, 5 years, I'm not sure. So nice to meet you all.
Thank you. So, of course, I'm Deb Stittman. I'm currently the Director of Addiction and Residential Services at Johnson County Mental Health. I started on the advisory committee for addiction counseling when the license was passed. So I think 2011. And then I was just trying to remember, I'm not sure when I became a board member, 2017, 2016, I don't know. So I am on the second end of the 4-year. You can serve 8 years, and that's what you can serve on this is 8 years. It does kind of fly by, in my opinion. But of course, you don't have to serve 8 years. We'll be having that conversation every 2 years to see if you care to continue to serve if you haven't already left, and I'll give you that graceful out. I understand that energies change and interests change and demands change, so it's all good. It's whatever you need to do. So I will point out that everyone talked about how long they've been in the field except Jason and I. I think that's probably by design.
We don't really want to out ourselves that way, do we? I don't understand what Lisa and
I don't know.
problem is.
Everything I've done, I wear mine with a badge of honor. I think I'm going to get a tattoo, honestly. So I'm at nearly 37 years in the field. How about you, Jason?
I'm at nearly 28 years in the field.
Okay.
So, yep.
All right. Well, I get the cookie. So anyway, all right. Well, thank you everyone for introducing yourselves, because I think that gives Chad and Charity a good sense of who they're working with. All right. So I think next we are ready to review and approve the minutes from the advisory committee meeting from September. Hopefully you all had a chance to look those over. They were long. That was a lot of information in those minutes this time. So
I'll move to approve them.
Thank
I'll
you,
second.
Mike. Thank you, Dulce. All in favor, say aye.
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 Any opposed? Okay, minutes are approved. All right. So I think we're ready for David Fye's report. I really didn't give you guys a chance to introduce yourself. David and Leslie, my apologies.
No problem. We can go ahead and do that now if you want.
Okay, that'd be great.
So I am David Fye, Executive Director of the Behavioral Sciences Regulatory Board, and Chad and Charity, it's nice to meet both of you. We've talked over email a few times, but it's nice to be able to put a face with the name, and look forward to working with you both on the advisory committee. People had shared a little bit about their backgrounds, so I'll go ahead and do that too. I'm coming up on the end of my first year as Executive Director for the BSRB. I came over from working for the legislature. The previous 8 years before moving over to the BSRB, I had served in the Legislative Research Department, and I had primarily been a principal fiscal analyst. And so on the side of the office that dealt with a lot of the fiscal measures and staffed a lot of the main money committees like House Appropriations, Senate Ways and Means. I focused on agency budgets, specifically health budgets, and became one of our agency's mental health experts, and staffed a number of the committees that dealt with health topics relating to mental health, and worked with the Department of Aging and Disability Services, had a chance to see both of the state hospitals that deal with mental health. And that's how I became connected with the BSRB, and had a chance to meet the previous executive director, Max Foster. Yeah, it's been a really rewarding year. It's been a busy year, and the agency really does cover a lot of grounds with the 7 unique professions that are overseen by the agency. I'm originally from Kansas City, but I've been in Topeka here, where the board office is, for just about the last 23 years or so. So it's been really good. Looking forward to continuing to get to know all of you more with the advisory committee, and work with you more as you work in the different areas. So I'll go ahead and I'll turn it over to the Assistant Director and Licensing Manager, Leslie Allen, and she can just say a few words and introduce herself to all of you.
Hi, I'm Leslie. I have been with the board since 1999. Prior to that, I grew up in Southern California and I moved here in 99 and I've been here ever since.
Very good. I think it might be worth, I didn't know this for a long time, despite my longevity with the BSRB. And even prior to that, when I used to work with Leslie, when I worked in the state office, the fact that we're set up very uniquely here in Kansas with one board and one agency overseeing such, frankly, diverse licenses. So I've heard like we're completely unique in that regard. Is that right, David?
I think so. There are other agencies in different states that combine certain groups like professional counseling and marriage and family therapy. But I think our composition is unique. I haven't met another individual from a state where we've had quite so many and quite the range of professions. Now, there are some agencies in different states where they group a lot of regulatory boards all together. And they share a lot of resources, but we're really set up differently to try to facilitate each of the professions separately under the general topic of mental health primarily. So, but yeah, it does make for some unique situations and some interesting conversations, especially when you meet people at different groups and different conferences and things like that.
So just to kind of go with that for just a minute, again, mostly for the new folks, but I think even for the current members. So I think at times BSRB, certainly people have head scratching. Well, why can't they do more, change more, whatever the word is. And I think people don't really understand that when you have such diverse licenses, because they all came up differently, right? We're all different stages, and certainly addiction counseling being one of the newest. And we try to align things as we go, right? So that things are as similar as possible to cut down on confusion. But different license groups have different ideas about how things should be, and so I personally love it. Despite the challenges, despite the, because it'd be easier, right? If we just all blew up and everybody could just be their own kingdom, right? I wouldn't mind that. No, I'm just kidding. So, but I think it's good. I think it's good for the professions. I think it's just good for consumers to kind of trying to swim all in the same direction, as bumpy as that can be sometimes. So just to give you that little context when we discuss things. So for example, it's not unheard of for addiction counselors to say, hey, BSRB board, we would like to change something, reduce the requirements, add a requirement, whatever it is. That can happen. But you also have to look at the impact on the other professions, right? So is that going to make our license less desirable, more desirable? What's the impact on everyone else? Is that something others should consider? And if so, should we do it all at once? What's the impact if everyone does it but one profession? I hope I'm painting the picture of how interesting this can be sometimes. Any questions or other comments before I move on? All right, I've stunned you with boredom. Awesome. So, David, it's your turn.
Okay, I'll go ahead and report on a couple different items. First, I wanted to just touch on the Kansas Open Meeting Act and some other new member information. We do have 2 new members of the advisory committee, but I feel like this is good information to everyone to hear from time to time, and just get some reminders about last year in the spring. Legal counsel for the board from the Attorney General's office attended each of the advisory committee meetings and did a training for board members and advisory committee members, and talked about certain topics that you should be aware of as advisory committee members, including things like the Kansas Open Meeting Act. Right now, because of the pandemic and the direction from the governor's office, all of our meetings are being done remotely. So they're all being done by Zoom. but we also want to provide public access. And so we're streaming those on a YouTube channel that we created earlier this year for BSRB meetings. And so board meetings and advisory committee meetings, those are streamed. And we allow individuals to go ahead and watch the meeting as it takes place by streaming it live. And then it's available on the YouTube channel for people to go back and watch or listen to after that. So we also have a conference call line where people can call in. We do occasionally get guests and visitors that come to meetings, but it's important that activity by the board and by advisory committee meetings or members is done in an open meeting. And so one thing that you may not be familiar with under something like this is that while we definitely want your input, we want you to work together, there are certain restrictions on when you can work on those things and where you can work on those things. So under the Kansas Open Meeting Act, primarily if you have the majority of members of the board or majority of members of an advisory committee that are working on advisory committee business or board business, that really should take place at a formal meeting. And so you want to make sure that you don't have members all come together and meet somewhere to where we haven't been able to provide notice or we haven't been able to provide access to the public. And sometimes it can seem very obvious, but at other times it may not be so obvious. For example, you want to make sure that you don't send an email to the majority of members of the advisory committee and have a discussion over email back and forth, because that could be something that would be a violation of the Open Meeting Act. Now, it's also important to know that you have general rules and concerning members of the committee. We as staff here at the BSRB, we have some different rules that we follow. So we are allowed to contact you and work with each of you on the same topics. It's just that when you work together as a group, you need to make sure that you're doing it at a formal meeting. So we, depending upon the board's conversation on the topic of training, we may have more formal trainings in the spring for each of the advisory committee. But since some of you are new to the committee, I wanted to go ahead and just have a preemptive conversation about some of these topics. So if you get, the part of this is about sending emails back and forth to each other. So you want to be cautious about that. There's also, when I send out information on behalf of the board or the BSRB, you want to make sure that you don't hit reply all and start a conversation that way. And so I can send information to you, you can receive it, respond back to me directly, and I can work with you, but just something to be cautious of, just to avoid any kind of thing that could be construed as a discussion by the members of a committee outside of a meeting. There are more things to the Kansas Open Meeting Act. We had the script earlier today just to provide some notice to individuals about where they can get information about the meeting, such as where they can find the agenda, meeting materials. We do make an effort to provide that to the public too by posting it on the BSRB website. And there's a lot of resources on that we make for the public, but some of that is due to some of the guidelines of the Kansas Open Meeting Act. So wanted to make you all aware about that. We'll provide some more information for you in the spring, but wanted to have that conversation just about those issues. And thought I would pause now and just see if any of you have any questions along that topic. Okay, if not, feel free to send me an email if you do have any questions or if you're concerned about anything. In terms of communications, as you are a member of the advisory committee, you can definitely speak to individuals. You don't have an obligation should a member of the media or a member of the public contact you due to your role as an advisory committee member. One thing that we do here at the board office is that if there are topics relevant to the advisory committee, we ask that individuals contact us to ask to request to provide public comment or provide materials to us, and then we can bring it to you for your discussions. But we want you to know that should someone contact you and say, would you be willing to have a conversation on this topic? You want to make sure to loop in our office so that we're aware of those conversations and we can assist you. Not to say that you can't talk about items as you are a member of the advisory committee, but just want to provide the right resources for you and also let you know if it's in a question about what should be in a meeting versus what could just be a normal conversation. So like I said, if you have any questions about any of those topics, just let me know. But as Deb said, really excited to work with all of you on the advisory committee in another year going forward when we start meeting again next spring. The second item, after talking about the Kansas Open Meeting Act and also some of that new member information, is that every meeting as executive director, I provide the board and advisory committees with some general updates on the BSRB and on items that might reflect or might deal with their action as the advisory committee. And so I'll provide a few updates now. First is that due to the pandemic, the governor did issue a directive earlier this year. There was one that had been done last year to have most of the staff members working remotely. That was ceased in June of this year, and staff were able to go back to the office every day. In August, the governor did go ahead and go back to that directive. So right now we have most of our staff members working remotely on a day-to-day basis. The governor did ask that we keep the main office open. So we do have staff here in the office, and we do have some walk-ins, but we try to direct people to go to the website and do things where they're not in person as much as possible, just to make sure that everyone stays safe and healthy. We do respond to individuals by phone. We've been able to get some access to individuals working from home through the use of things like Jabber technology. So we can make outgoing calls when staff members are working from home. It's just a different way of doing things, but as we get more and more familiar with it, we've been working out some of the logistical issues over time. We are currently under the directive to continue working mostly from home until January 4th. It is possible that that could be extended. It was previously through the end of October, and it was extended at that point to October 4th. So it's possible it could be extended again. But if you have any questions on that topic, just let me know. One major change that we did make over the last couple months is we worked with the Office of Information Network of Kansas, Inc., to launch a BSRB payment portal on the BSRB's website. And it's a way for us to receive credit card information for payments as well as electronic checks. And we're really excited about this. We did work with them on several different variations of it and worked through some of the language. But this should allow individuals to make payments to our office in a more secure way. And it also should help with the timeline in trying to cut down the number of days to process certain things. And so individuals now can go through the payment portal and make payments automatically. So that's really exciting. There's no change to the online renewal process that other people had been using before. But some individuals who did the paper renewal, they can now submit their payments electronically. And individuals who are working on the initial applications, they can make payment immediately when they're submitting those materials. So it's a big change. We're really excited about it. And it's been a little bit extra work for staff to get it all up and running. I really appreciate their effort, but it should be a really good thing going forward for us. Next item is on some staffing updates. So to assist us with different tasks around the office, we recently brought in a temporary employee to assist us with some light clerical tasks. And she's been with us now for about a month, and we appreciate her assistance. We also have been able to fill a position recently. We had an open administrative assistant position with the BSRB, and we have hired a new employee, and she is starting on Monday, December 27th. So we'll be working on training her and getting her up to speed on our processes. The board has an annual planning meeting once a year where the board talks about big items relevant to the board and the professions, and also any major recommendations that have been discussed by the advisory committees. It is generally in September of each year. With the pandemic, that was split into 2 half days, the first occurring on September 27th and the second on October 25th. The items that were discussed that I want to make you aware of, during this past year, the advisory committees had discussed one topic that involved potential changes to continuing education requirements. 2 of the professions had been approached by individuals asking if there could be a change to statutes requiring additional hours or hours in general under the areas of diversity, equity, and inclusion. And I think all of the advisory committees had discussions about whether there should be a change to statutes to require that. Ultimately, at the board's meetings, the licensed psychology profession decided to go ahead and move forward with the direction of the board to require 3 hours for licensed psychologists. The licensed psychologists are currently required to receive 3 hours of ethics and 6 hours of diagnosis and training every renewal period. And so as one of the items involved with requiring these 3 hours, they asked that the 3 hours could be counted more or less to allow for some double counting. So if you had an ethics 3 hours that also could qualify under the diversity, equity, and inclusion, you could count that CE for the 3 hours of both. If you had something that might qualify for 3 of the hours under diagnosis and treatment that also involved diversity, equity, and inclusion, you could double count under that category. But it didn't eliminate any current requirements. It just added a new requirement, but allowed for some double counting. And so that will be in one of the items that will be going to the legislature on behalf of the board when we make a bill request this spring. The other professions spoke on that topic, but did not move forward with requiring any changes to statutes in that area. The next item was records of deceased practitioners. There was a conversation earlier this year on the process to handle records when an individual is usually a sole practitioner who has records and they pass away unexpectedly, and you have records at a home or another location. And the question is, what should be done in terms of establishing a new custodian of those records, or who would take those records temporarily? So we've had conversations this year with many of the advisory committees on possible solutions to that. The Attorney General's Office Consumer Protection Division will seize records temporarily, and we have been working on some logistics to see if we could work with them. There was a conversation about if it could be established as a clear responsibility for professionals to identify who would be the new custodian of the documents. And then if that was to go into effect, if there would be a change on the renewal application for individuals to list who would be the new custodian. And really working through the mechanics of implementing something like this, there were a number of issues that came up in terms of how to actually establish the custodian for the records. And the Attorney General's responsibility was a little bit more tightly construed than what we originally thought. They do seize records, but primarily when they're in danger of someone finding them and being able to have access to them when they shouldn't. And so there are many cases where it might be a situation involved in this topic where they wouldn't currently seize the records. And so we're still working through the logistics on how we can be helpful in this area, but we wanted to make sure that we could continue to research it before we went ahead with the requirement for practitioners. So this is a topic that we'll probably continue to work on over the next year. The board also reviewed a document called the Board Governance Policy. This is a document which outlines some of the responsibilities of board members. It was something that the board had passed. It's not something in statute or the regulations, but it had been updated last about 10 years ago. And as a way of reviewing it and looking for updates, that was discussed at a couple different board meetings, and I had created a report with some potential changes to the document, and the board had a really good discussion on potential changes and went ahead and authorized some of those. There's also some language in there about the composition of advisory committees and the way to go about recruiting new members for advisory committees. And so some of that did change and was modified. And a new draft of that document will be available for the board at the January board meeting on January 10th. Another item was meriting the public trust. So as one of the requirements for licensure, along with looking at individuals such as educational background, experience, and things like that, the board must certify that the individual merits the public trust. And there are different standards in different states when looking at things like moral character. So the board had a discussion on the language. We asked our legal representation from the Office of the Attorney General to weigh in terms of the standard across different states and what would be the preferred standard, or at least the most acceptable standard. And legal representation did share that meriting the public trust was the prevailing standard across the nation. The board did ask us to go forward with looking at some ways to better clarify some of the materials that individuals might be able to provide when they supply information to the board. So we are working on sort of an FAQ in that area. And then we'll be providing that information when individuals need to provide information to the board. But we'll be taking this to the board when the board meets again in January. There was a revision to the board's website posting policy, primarily involving discipline. Legal counsel did weigh in on some of the current language in our website posting policy. There were no substantial or significant changes to what would be posted or what wouldn't, but the language did better help clarify some of the items that would be posted and why they would be posted. And then one other item is that, as I mentioned earlier, we do have members attend to meetings from time to time. When I worked for the legislature adopts a general policy for guidelines for public attendees, as they have members frequently attend their meetings and wish to provide feedback for the legislative committees. The BSRB really doesn't have a lot of public attendees, and in the past, we've invited individuals to speak to the board or speak to the advisory committees at times. But earlier this year, it came up that we should look to establish more standards in terms of providing guidance to the public on what might be acceptable topics or what might be something that could be provided to the board in a different way. And so we are looking at some language that we can provide for the board and advisory committees to provide more of an outline for the public about what would be acceptable for public comment, or maybe what should be provided to the board in a different way. Outside of those issues, I wanted to make you aware of a couple of legislative items. There is a legislative committee that was meeting this fall. It was a legislative special committee on mental health modernization and reform, and that committee did meet last fall as well. The committee had a number of different participants. There were legislative members, but there were also non-legislative members who were part of working groups to discuss certain things, including the topic of telehealth specifically. And Leslie Allen and I were invited to attend a couple of those meetings and answer a few questions and provide some feedback. But the recommendations from that group will be formalized at the end of the fall, and they will be made available. And so we'll be bringing those recommendations to the board so that they can review those. The recommendations from the committee are specifically for the legislature, as it's a legislative committee, but because it does cross over to a lot of the work of the BSRB, we've been tracking and trying to follow a lot of the work that that group has been doing this fall. On Monday of next week, I have been invited to participate in a meeting of the Legislative Budget Committee. Each year, state agencies are required to submit a budget in September. And as part of our budget process, we've provided some performance measures on the BSRB. And so, representing a small agency, they asked me to attend along with about 5 other agencies and to speak briefly to them about their performance measures. So I'll provide an update to them on Monday. And the last 2 items I wanted to provide an update on. Earlier this year, the legislature passed a bill establishing the Kansas Fights Addiction Grant Review Board. And it also established a Kansas Fights Addiction Grant Fund for the receipt of certain funding from state lawsuits involved, state lawsuits that would involve addictions and different things like that. It would collect the funding and make some of that funding available to groups who provide addiction programming, that they could apply for some of that funding. That group is put under the Office of the Attorney General, and I have been contacting them seeking updates. The group has not yet met. But I'll continue to track that and provide updates when we know more information about that. It's possible there could be some further work with that during the 2022 legislative session, or not, but I will keep an eye on that. And I have a contact with the Attorney General's office that I've been asking them about. So we'll keep an eye on that group. And then the last update, the legislature this year heard a bill on an overdose fatality review board. The legislature didn't pass the bill. However, KDHE, Kansas Department of Health and Environment, did receive a grant from the CDC to study fatalities related to overdoses in Kansas. And they were allowed to go ahead and meet, even without the legislative passing of that bill, on a voluntary basis. And so they asked if we could have a member participate in those meetings. They met twice. They were primarily planning meetings. At the second planning meeting, there was a consensus among the individuals who were present that they would like there to be more legislative support for that group. So I think they're going to have a renewed effort to have the bill potentially passed in the spring of 2022. So we'll continue to track that group as well and provide updates as we learn more. And with that, I will go ahead and end my report, and I can answer any questions.
Thanks, David. Any questions about any of the updates?
I had a quick question about the, you mentioned the and I know we had discussed in this group the DEI requirements. Is that something that will continue to be explored, or you'd mentioned the one discipline going ahead and taking that forward to possibly look at getting that passed? Is that something that we'll be addressing again, or are we kind of moving on from that at this point?
Oh, that's a great question. I mean, there's nothing, like nothing's ever really final, right? So this committee can certainly discuss that, this upcoming year. As I reflect on the discussion in the board, I'm happy to put this on the agenda for March if you would like. But just in general, for me, having been part of trying to implement things statewide and how the intent and the outcome can sometimes not match very well, I have concerns, not in the intent at all. I think that it's a very worthwhile intent. What bothers me is the ability to actually measure, have something tangible for such a, diverse topic, right? So ethics, you could make the same argument, or even diagnosis. But this one feels a little different to me, because when you start looking at DEI, then diversity, well, that means people that are living in rural areas. That's diverse, right? That's a different topic. I just worry that whatever's all in our heads and whatever gets implemented isn't necessarily the same intent or effect. So, and that whole dilemma about how prescriptive do you make things? So just for an example, what psychology has done, I appreciate certainly the double counting, if you will, but to say that DEI and ethics could be it starts to make the case for what I'm saying, in my opinion. It's like, so what does that look like? I don't even know what a diversity, equity, inclusion, and ethics would look like. I can get there a little quicker with diagnosis and treatment, I guess. That one makes more sense to me. I don't know. So that's some of the discussion we got into as a board. There was certainly not widespread, that's a terrible idea. Just, you also bump up against kind of government overreach, like how prescriptive do we want to be? It hasn't been that long ago that we were approached about adding some sort of suicide training as a requirement. There's been, when we had the death of the social worker, it was, well, we need to mandate safety training for people. So again, not discounting the importance of that topic at all. And I'm a big fan of doing things institutionally to address institution problems, because that is certainly a layer that has been ignored in that particular topic. So, thoughts?
I guess I would love to have further discussions on it,
Okay.
Deb. I think
No,
that
I know
look
you
at
feel passionate about it, and you weren't at the last meeting.
Yeah, I know.
And
That's
we
unfortunate.
kind of ended up in a neutral spot, right? We
Yeah.
said if all the professions or the majority decide to do something, then we'll kind of go along. But at that point, we didn't feel strongly enough, given the concerns, to stand out by ourselves. So I didn't know psychology was going to, go that direction until the board meeting. So sure, I'm happy to put it on the agenda for further discussion.
Thank you. That'd be perfect.
Because again, I look forward to what you might bring to that discussion, given your passion about it.
I wanted to offer up to the Social Work Advisory Committee did a survey primarily relating to supervision about 5 or 6 years ago. And they have met this fall and worked on new survey questions to be sent to licensees. And they went ahead and included a question on the survey that was recently sent out, asking for licensees to provide feedback on whether there should be a number of required hours under that topic. So
Oh, that's really good.
So I will let you know when I collect that feedback from the individuals who respond to the poll, and just let you know how that one turned out as well.
I actually just saw that too. So I'm licensed under social work as well. So
Yeah, I did too. Yeah, that was
Well, that
good.
might
That
be
was
something
good.
for us to consider.
Thank you, Deb. I appreciate the opportunity just to maybe touch on that again in our next meeting. That'd be great.
Not a problem. Other comments or questions about the upcoming session? Leslie, I'm trying to remember what we decided in this discipline that it's very specific to go forward with. And the one thing that stands out just for, again, the new folks, is that we're going to change the statutory language to allow master's level mental health professionals to test and qualify for the LAC, whereas right now they cannot.
We did masters and clinical.
Oh, sorry. Well, that was implied in my mind, but
Okay.
Yeah.
I just wanted to make sure.
no, thank you. So as most of us remember, when all the grandfathering happened, we didn't have the LMAC level. And so if you couldn't qualify for the LCAC for whatever, then you kind of defaulted to the LAC. And we created it and we moved everyone up that could. So that was all great and easy peasy. But then somehow we added language that prohibited someone from testing out at the lower level, if they should want to or could not pass the test. And some people just aren't good test takers, right? So I've encountered that here. Very competent professionals just having a really hard time with that higher level test and seemed ashamed to just keep them out of the profession, especially if they're already a master's level, social worker or the like. So what else am I missing or forgot that we're doing specific?
So I think there's three primary items. That's the one that directly involves the addiction counselors. There was the other item, the licensed psychology, moving ahead with the CEU change or the CE change. That would be something that would need the statutes amended. So that will be something that will be in statutory change in the bill. And then the other item is really more of a cleanup item. Last year, when the bill went through 2208, there was an amendment that was put onto the bill that involved social work that struck the requirement for the 350 hours. But the actual amendment itself struck additional language after that, which allowed other type of hours. And so it's limiting how much flexibility we have. So we're asking for that extra language to be put back in as a cleanup action, not putting in the number of required hours, but the flexible language that allows for other types of hours as approved by the board. So a lot of the other items the board had worked on this past year were really more changes that could be made in regulations instead of bill form. And that's something, if the new members aren't familiar with how the legislative process works in that area, there are statutes which are basically the result of language that's put into bills and passed by the legislature and then signed into law by the governor. And that provides the overall framework for the professions. And then within that, agencies are allowed to implement rules and regulations. And that comes from the product of discussions and these type of meetings. And then those have to be approved by the board to go forward. But then language is submitted for the Division of Budget to review, and they provide feedback on that language. And then there's a public hearing period. And then ultimately that language will go into the rules and regulations, but that's kind of a two-step process. So some things we have a little bit more ability to adjust without a bill and regulations, and other things we put into statute, and that goes before the legislature.
Yep, thank you for that. We have some regulations pending, correct? In process?
Yes. Yeah, we submitted quite a few pages of regulation adjustments. We've been informed that it's they're busy with other responsibilities, which is completely understandable. So I don't know of the time frame when we'll get those back, but those have been submitted to the Division of Budget. They're reviewing them, and then they should be providing us either with some feedback or at least information on the next step and when that's ready to go forward.
Okay. All right. Other comments, questions, agenda items for our next meeting? Don't let them fool you guys. This is a very talkative, very opinionated group. All right, we're right to 12 o'clock, so I would entertain a motion to adjourn. We're going to meet on March 18th. Is that going to work for most people?
I move we adjourn.
All right,
I'll second that.
all right. All in favor, say aye.
Aye.
Bye.
Aye.
Okay.
Bye.
We all have great holidays and be safe.
You
too.
We all do.
Bye, everyone.
Alrighty.
Take care, everybody.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Oh, she does.